Dr. Rohan Palshetkar, obstetrician, gynecologist, endoscopic surgeon, and fertility specialist. I'm practicing at D.Y. Patil Hospital, and I'm also a proud alumni of the D.Y. Patil University School of Medicine, Nerul, Navi Mumbai. I'm really glad to be a part of the MediTalks Season 2, and I want to congratulate the Mediscape community and the Alumni Association for taking this initiative to bring us alumni back to talk about some very sensitive topics in the field of medicine. Today, I'm going to be talking about IVF and infertility. And this is something that needs to be talked about quite a bit, and the awareness about this has to be brought up quite a lot.
As a fertility specialist, what is your take on assisted reproductive technology, also known as ART?
ART is something that's really close to my heart, and the technology that's there available has made it possible for so many childless couples to have the ability to achieve parenthood. So ART is something that has encompassed from the 1970s till today. And we can see that with the advent of the technology that's present, we've gone from a success rate of almost 1.8% to close to 40 and in some cases even 60%. That's why I'm saying that ART has given a lot of couples a chance to conceive.
When should couples consider IVF?
If you're a couple that is below the age of 35, then understand that you can actually wait up to a year to think about conceiving. If you are a couple above the age of 35, then after 6 months, actually think of going to an infertility specialist to get advice on how to conceive. This is the most important factor, age, because that's something that's going to affect the success rate of you getting pregnant.
What are some factors that determine the success or failure rate of this procedure? What is the percentage of each according to your expertise and available data?
So there are a few factors what I look at. One is age. Second, I look at the ovarian reserve of a woman. I look at the uterus, the fallopian tubes. But infertility is not just about the woman. We also have to look at the male partner. So the most important factor in a male partner is the semen analysis, which tells us about the motility, the count, as well as the morphology. These are all the important factors that are going to determine the success of your IVF. Also, what you need to understand is whenever a couple is coming to me, I look at all these factors and then I generally divide them into either male fertility, female fertility, the couple, or unexplained infertility. So when I'm looking at a couple, I look at 30% of patients to have female infertility, 30% of patients to have male infertility, 30% of cases where both the male and female are affected, and 10% of patients are unexplained infertility where there's no real cause to know about the cause of their fertility status.
How many cycles of IVF are necessary for a successful outcome? When should one stop continuing with it?
Generally, we say that there's easily a 40 to 50% chance of conceiving in your first attempt itself. But there are some cases where you do require multiple attempts, especially patients with maybe a poor ovarian reserve. At that point, they may require multiple cycles to get a pregnancy. Now, when to stop an IVF cycle? That's actually a big dilemma. There are no real guidelines on which says that you need to stop at this attempt. But I would say personally, after maybe 4-5 attempts, you should look at other options as well to conceive. We do have things such as donor oocytes, donor sperms, or even surrogacy where we could consider doing that in case a self-cycle has failed.
Is the IVF process taxing on the woman's body?
So, any procedure that you undergo is going to have a little bit of an effect on your body. But the advantage of IVF is that it is a quick recovery procedure. A woman is not even admitted for an entire day when we're doing the pickup. She gets to go back home the same day in the evening itself, and she can actually resume work the next day. But of course, in any infertility case, the female has to undergo all the injections, has to undergo all the procedures. So to an extent, it will take a little bit of a toll, but at the end of the day, she's going to be able to go home, resume her work, do her day-to-day duties. So it's not that much of a toll on the body as people actually think there is.
Can you elaborate on the importance of counseling for the sound understanding of the couples and decision making with reference to the IVF process?
So I think counseling is the most important part of the entire IVF cycle. Firstly, the couple needs to understand their situation. Secondly, they need to understand the procedure that they're going through. So without the counseling, they're not really going to understand. I always believe that it needs to be a dialogue between the doctor and the patient. It shouldn't just be a one-way street. So when I'm talking to a patient, I actually sit down with them for at least half an hour to 45 minutes, explaining to them the nuances of the process. Not only what they're going to undergo, but what we are going to do in the lab with their gametes. So that's something that's very important in the field of IVF. Talk to the patient, understand what they are going through, and explain to them what they are going to go through in the future for their treatment protocols. So when I'm counseling my patients, I always look at the factors. And then when I explain everything to them, I'm able to help them take a decision on whether they need to go for a natural pregnancy, whether they need to go for assisted reproductive technologies such as IUI or IVF. Once everything's laid on the table, I explain to them also the success rates of each of these procedures. So this actually helps them to take a more informed decision regarding their treatment.
IVF is the only cure for infertility.
No, there's so many different ways of getting pregnant. Firstly, you have to find a cause. What is it? Whether it's the tubal factor, whether there's something with the uterus, whether there's something with the sperm. All of these can be either treated through medicine or through surgery. So IVF, as I say, is I keep it as the last option for the couple. It depends on what the causative factors, and based on that only we decide the treatment. So whenever you're going to an infertility specialist, don't think that IVF is the only thing that's going to cure you. There are other ways, and we are experts in those to ensure that you get the best possible treatment in the best possible way to make sure that you achieve parenthood.
If one cycle of IVF fails, the chances for conceiving are closed forever.
That's absolutely not true. Just one cycle of IVF, if it fails, does not mean that you're never going to get pregnant. As I said even at the start, there is a 50% chance of you getting pregnant. So just because one cycle fails doesn't mean that you will fail every time. I've had a patient who's undergone 5 IVF cycles and gotten pregnant on the 5th attempt. So just because your first cycle has failed, don't give up hope. You still have a chance. Give your doctor some time, and I promise you that they will find some way to help you get pregnant.
Since IVF is an expensive process, do you think it limits the benefits of it only to the privileged sector of the society?
So IVF is on the more expensive side, but look at me, I'm working at DY Patil and I'm actually running a budget IVF center where I can make it affordable for a lot of patients. So yes, it is somewhat available to the privileged society. But now as the advancements are increasing and this field of medicine is getting older, the costs are coming down and this technology is being made available to almost everyone in the society. So it's not just the privileged that are benefiting from IVF. In fact, at DY Patil, because we're doing a lot of budget cases, we have patients from the lower income group who are taking babies home, and trust me, I see the joy in their faces. I see the happiness in their eyes when they actually achieve parenthood.
Do you think IVF can be made more cost effective? If yes, how? And if no, why?
So yeah, IVF I think can be made cost effective. Firstly, insurance policies. That's the main thing where under what infertility needs to be covered. Currently, insurance doesn't cover fertility. In fact, with Narendra Modi ji making such insurance policies available to the lower sections, we can actually have infertility practice covered under that, which will give these patients an opportunity to achieve parenthood without actually having to spend out of their own pocket. So yes, infertility treatments can be made more cost effective for the couple. Of course, our equipments and everything that's required is expensive, that needs to be covered. But with insurance policies covering infertility, it's going to be made a lot more accessible to the general public.
As a fertility specialist, what would be your advice or a take home message for the viewers?
As a fertility specialist, I understand now everyone is career oriented. We all want to focus on our careers, maybe think of delaying parenthood. Fair enough, I agree with you. I myself delayed my parenthood. But I had the awareness about fertility. I had the awareness about fertility preservation. So if you are thinking of delaying your careers, consider embryo freezing. Consider oocyte freezing if you're an unmarried girl who's focusing on a career, hasn't found a partner. These are options which are available to you and you can think about it when you're looking to the future.